What Dr. Oz has said about changing Medicare. Dr. Manette Oz is President-elect Donald Trump's pick to run the Centers for Medicare and Medicaid Services. Announcing the nomination on Tuesday, Trump wrote in a statement, "Dr. Oz will be a leader in incentivizing disease prevention, so we get the best results in the world for every dollar we spend on healthcare in our great country." Trump continued, "He will also cut waste and fraud within our country's most expensive government agency, which is a third of our nation's healthcare spend and a quarter of our entire national budget." If confirmed by the Senate, the celebrity heart surgeon turned TV star, who has been criticized for promoting health misinformation, would be responsible for the three federal programs, Medicare, Medicaid, and the Affordable Care Act, that more than half the country relies on for health insurance. Expand article logo. Continue reading. Trump promised during his campaign not to cut Medicare, which provides older Americans and the disabled access to health insurance. Newsweek has contacted Oz and a Trump spokesperson by email for comment. Here, Newsweek rounds up what Oz has previously said about changing Medicare. Oz has a long history of endorsing Medicare Advantage, the privately run version of Medicare that has come under scrutiny for overbilling of the government by insurance companies. Believe it or not, it is possible to get health insurance plans now with a $0 monthly premium, he said in the segment on his show promoting Medicare Advantage, according to a video posted on his YouTube channel in August. Millions of people already are doing it, and so could you. Oz promised to expand Medicare Advantage coverage during his failed 2022 bid to represent Pennsylvania in the U.S. Senate. Asked how he would strengthen Medicare if elected, he told the AARP that he would do so by expanding Medicare Advantage plans. These plans are popular among seniors, consistently provide quality care, and have a needed incentive to keep costs low, he said. In June 2020, Oz co-authored a Forbes article with George Halvorson, the former CEO of Kaiser Permanente, that proposed a Medicare Advantage for all system that they dubbed Medical Advantage. The plan proposed eliminating employer-provided insurance so every American who was not on Medicaid would be enrolled in a Medicare Advantage plan. Doing so would give security to all Americans concerned about the quality and cost of care, they wrote. "We could fund this universal coverage entirely with full financial security by using an affordable 20% payroll tax, which is close to the amount most employers currently spend to buy insured care," Oz and Halvorson wrote. They also argued that this approach would significantly reduce administrative costs as a country. Extending the standard Medicare program would be more difficult on multiple levels, they said, and doing so would require an entirely new infrastructure with intermediaries.